Hey, Denture gang. Look, I got new glasses. Anyways, I wanted to talk to you about something today. I'm freezing cold. It's just a foggy day on the Oregon coast. So I get so many messages in my inbox and emails about patients who have gotten new dentures and they are so stinking big. I think that maybe the providers should listen up. Okay, so I'm not trying to speak out against any providers here, but maybe you guys are not doing things correctly. So let me just break down this whole bite thing. Okay, the bite. Let's break it down even further. The vertical dimension of occlusion. Vertical dimension of occlusion is when the patient is biting together closed like this. Okay? The vertical dimension of rest is when the patient is relaxing their face, barely letting their lips touch together. And if you looked inside, the teeth are not closed together. There are parameters about how far away those teeth should be from each other, and it's kind of an average. So it's an average of about 2 to 5 millimeters that when the patient is at rest, their teeth should be apart, as opposed to the vertical dimension of occlusion. So when we measure this, and I've got a pretty good video of me doing this on a patient, I put a dot on their chin right here. I put a dot on their nose with a Sharpie pen, and if they're nice, I'll take it off before they go home. Just kidding, I always take it off. Anyways, we measure that. So I have a gauge. It's called a Bowley gauge, and it's this little metal, I'm not at work right now, but it's this little metal caliper kind of. So I put these dots on the patient's nose and chin, and I have them lick their lips and totally relax their jaw and barely let their lips touch together, which inside their mouth would be like this. Okay? Total rest. Then I use those guidance rules of 2 to 5 millimeters, but I'm going to determine how many millimeters that is by measuring. So when the patient doesn't have any teeth, they're edentulous, which means they have no teeth in their mouth, they just have gums, I have to determine those measurements without anything to guide me except for the education that I've been given to establish the vertical dimension of occlusion, the vertical dimension of rest. So one of the ways that you can measure that vertical dimension of occlusion when the patient doesn't have any teeth is have the patient go to resting position and then have them swallow. When the patient swallows, it puts them in that automatic closed position in their mouth. It puts their jaw into this neutral, it's called a centric position for the providers out there. So if you do not get these measurements correct, you'll have a patient, and I have a inbox full of them that look like this before their dentures that you've made for them. And then they put their dentures in that you've made for them, and they look like this. Okay, because their dentures are too tall. You know, this happens sometimes when patients get immediate dentures, because immediate dentures, it really takes a skilled dental provider to take the measurements correctly and transfer that information to the patient after their teeth are pulled. But there are parameters that we are taught. You should be getting this right so that the patient doesn't have a mouthful of dentures that are way too tall for their mouth and they don't have any room for food in their mouth because they're so tall. You know, if you have an upper denture that comes all the way down to here and a lower denture that's way too tall, how are you going to get food in your mouth? How are you going to even swallow if your jaw is not able to close that much. You're going to have jaw pain. You're going to have temporomandibular joint problems. You're probably going to have headaches, and you're not going to be able to tolerate wearing those dentures for any amount of time. I'm getting a lot of these, like I said, in my inbox, and it's pissing me off. So the only thing that I can think of, if these providers are not experienced, is to educate the patient. And that's what I'm trying to do on here. I'm trying to educate you so that when you go to get your dentures, when you are going through the immediate denture process, and this translates also to when you're getting replacement dentures and you've had dentures for years, that you can have this information in your arsenal so that when the providers are doing these things and or making these dentures, you can be like, hold on a minute, we need to measure my bite. Or when you get dentures that don't feel comfortable, you can say, my vertical dimension is off. I can't swallow. I feel like I can't close my mouth all the way. I feel like I don't have enough room for food in my mouth. Or even it can go the other direction. So if a provider makes dentures for you and you're over closed, you can have this kind of look. Okay, because your jaw is closing too much. And so then you're going to have these sensations of, I'm working way too hard to chew my food, because your jaw is moving way up to try to meet those upper teeth. Your lower teeth and your upper teeth are way too far apart. So you can also have that problem. I'm just trying to give you guys some great information to educate yourself when you're stepping into this journey, or you're in this journey for many, many years and you're getting new dentures, so that when they don't feel right, that you'll know what's happening. And for you providers out there, pay attention. Have a great day. Bye-bye.